It's usually really quiet.
Yeah, just the hum of the computer or something.
Right, exactly. That is the thing about this specific kind of research. It happens at like 2 in the morning in the quiet glow of a laptop screen or a phone.
When the rest of the house is asleep.
Yeah. But you're awake and you're staring at a cursor, typing these deeply complex medical terms into a search bar. And, well, if you're listening to this right now, chances are you or someone you love deeply is in the middle of a battle.
A really hard battle.
It is. You might be tired. You might be scared. And you're almost certainly confused by just the sheer volume of conflicting information out there.
Oh, absolutely. The internet is a loud place.
It really is. But above all that, you are hopeful. You are searching for just one more conversation that actually makes sense. You want to feel like someone understands what your family is going through without treating you like just another chart.
They're sitting in that seat at 2 in the morning. I mean, it carries a profound and heavy responsibility. Because the standard medical system, it has a way of speaking in a language that feels completely foreign, right, when you need clarity the most.
Yeah, exactly.
Stakes are as high as they get, and the map you're given is often just incredibly difficult to read.
Which is why our mission today is to act as a bit of a translator. For this deep dive, we're focusing on a very specific map for PlacidWay Pulse, and that is navigating immunotherapy cancer treatment in Mexico.
Right.
And to do that, we are synthesizing a really diverse stack of materials. We're looking at actual clinical protocols from treatment centers, medical journal abstracts detailing how these cellular therapies actually function, and practical logistical guides to understand the reality of crossing a border for medical care.
And I think it's vital to establish right away what this conversation is and, well, what it is not.
That's a great point.
Yeah. This is not about fear. It's not about putting pressure on anyone. And it is absolutely not about empty promises or guaranteed outcomes.
No, not at all.
Cancer is complex. And any resource claiming to have a simple universal fix is just not being honest. Our goal here is a calm, thoughtful discussion meant to provide clarity. We want to equip you with real, targeted questions to ask, an understanding of the biology, and a structured way to actually evaluate your options.
Right. Let's anchor this in the human reality. We're going to follow a fictional example today, but, his story represents the lived experiences of thousands of patients. Let's call him Robert.
Okay, Robert.
So Robert has already been through the standard protocols. He has done the conventional treatments, the surgeries, the chemotherapy. And now he's sitting at the kitchen table with his daughter, and she has this massive stack of medical records in front of her.
I've seen that stack so many times.
I'm sure you have.
Yeah.
She is helping him research immunotherapy in Mexico. And honestly, they're not looking for big promises. They're looking for clear answers.
And that mindset, that is the perfect starting point. Robert and his daughter are not searching for magic. They recognize that they've reached a juncture where they need to understand what else is scientifically available outside their immediate geographic radius. They're transitioning from being passive recipients of a standard protocol to active researchers evaluating global medical options.
Sitting there with that stack of records trying to decipher complex oncology terms while also just worrying about the physical toll on your dad, I can imagine how overwhelming that feels.
It's a tremendous weight to carry.
It really is. And it immediately brings up the overarching question, why Mexico? Why are cities like Tijuana, Cancun, and Monterrey becoming these hubs for advanced oncological care?
Well, the primary driver is a concept called the Integrative Oncology ecosystem, which we will unpack in detail in a bit. But practically speaking, it comes down to regulatory environment and access.
Access to the therapies, right?
Exactly. In many Western countries, the regulatory pathway to get access to, say, FDA pending biological therapies or highly customized cellular protocols, it can take years of clinical trials.
Years that someone like Robert might not have.
Precisely. Mexico operates under a regulatory framework that allows licensed, specialized facilities to administer advanced, scientifically validated therapies much more swiftly. For someone in Robert's position, time is the one currency they cannot afford to wait on. Mexico offers a bridge to access these therapies without that multi-year waiting period.
That makes total sense. But before Robert and his daughter can start comparing clinics in Tijuana or Cancun, they have to understand the science, right?
The foundation.
Because the term immunotherapy is everywhere right now. Let's slow this down and make it easier to understand. How does this fundamentally differ from the treatments Robert has already been through?
To understand this shift, we really have to look at conventional oncology first, which relies almost entirely on external agents.
Like chemo and radiation.
Exactly. The traditional approach surgery, radiation, and chemotherapy is fundamentally about introducing an outside force to physically remove or chemically poison the tumor.
Cut, burn, and poison, basically.
Yeah, that's the shorthand. But the problem is that outside force often causes massive collateral damage to healthy surrounding tissue.
Right, which is why people get so sick from the treatments.
Right. So immunotherapy flips the script. It is about training and reawakening the body's own internal defense network so that it can recognize and eliminate the cancer naturally.
Okay, so if the conventional approach is like carpet bombing a city to get rid of a threat, immunotherapy is more like updating the software on the city's internal security cameras so the local guards can identify the threat themselves.
That is a much more accurate way to look at it. And just like a security system has different components, immunotherapy utilizes different biological mechanisms. Let's look at natural killer, or NK, cell therapy first.
NK cells, I saw this mentioned a lot in the literature.
Yeah. NK cells are your body's first responders. When they detect an anomaly, they attack. But tumors are incredibly taxing. As cancer progresses, these NK cells often become outnumbered, or they just go biologically dormant due to the sheer effort of fighting.
Oh, wow. Which means the tumor is essentially winning a war of attrition.
Exactly.
So how does the therapy change that dynamic?
Well, the therapy involves drawing the patient's blood, isolating those dormant NK cells, and bringing them into a specialized laboratory. There, they are exposed to specific cytokines, which are signaling proteins that wake them up and force them to multiply.
So you're building an army.
You're culturing them into an active army of billions. And when those cells are intravenously returned to the patient, you have completely bypassed that exhaustion phase. You are introducing a massive, refreshed force that is hyper-focused on targeting the cancer.
That makes sense for the first responders, but the materials we're reviewing also spend a lot of time on dendritic cell vaccines.
Yes, very important.
And this introduces a term that trips a lot of people up, including me at first, antigens. How do dendritic cells operate differently than the NK cells?
So if NK cells are the blunt force first responders, dendritic cells are the intelligence gatherers. To understand them, you have to understand an antigen. An antigen is essentially a unique molecular fingerprint on the surface of a cell. Every cancer tumor has a specific fingerprint.
Like a barcode.
Like a barcode, yeah. Dendritic cells are responsible for capturing a piece of that fingerprint and presenting it to the T cells, which are the specialized assassins of the immune system, telling them this is the exact target, go find it.
So you are basically giving the T cells a mugshot of the cancer.
Yes. In this therapy, white blood cells are harvested from the patient and cultured into dendritic cells. In the lab, they are exposed to the specific antigens from the patient's own tumor. They are literally taught what the cancer looks like.
That is incredible.
It really is. When injected back into the patient, these dendritic cells circulate and hand out that mugshot to the T cells, prompting a highly targeted, customized attack. And here's a crucial detail to file away for later. This process relies on the immune system's memory.
Oh, we will definitely circle back to that memory aspect because that seems like the holy grail of this whole process.
That really changes everything.
But I want to bring up the third major category we found in the literature, which is checkpoint inhibitors. We're talking about PD-1 and PD-L1. How do these fit into the security system analogy?
Right, so cancer is a master of deception. It survives by exploiting the immune system's built-in safety switches, which are called checkpoints.
Okay.
Normally, these checkpoints prevent the immune system from attacking healthy cells. But many tumors cover themselves in a protein called PD-L1. When a T cell approaches to investigate, that PD-L1 protein binds to the T cell's receptor, essentially turning the T cell off.
Oh, I see. It's like a hacked transponder on an enemy ship. The radar pings it, but the ship broadcasts a friendly signal, so the radar just ignores it.
That is a brilliant way to conceptualize it. The tumor is broadcasting a fake friendly signal. Checkpoint inhibitors are specific intravenous drugs that block that interaction. They strip away that chemical disguise.
So they jam the signal.
Exactly. The moment that transponder is jammed, the T cell suddenly recognizes the tumor for the threat it actually is, and the attack initiates.
Okay, I need to jump in with some practical logic here because when we list these out NK cells, dendritic vaccines, checkpoint inhibitors, there is a real danger of treating this like a catalog.
Oh, absolutely.
Right. If Robert gets off a plane in Monterey, can he just sit down with a doctor and say, I think I'll try the dendritic cells and maybe add some checkpoint inhibitors on the side?
It is vital that we dispel that misconception immediately. You cannot simply select biological therapies off a menu based on what sounds impressive.
Right. It doesn't work like that.
Not at all. The mandatory first step, long before any cells are cultured, is a rigorous multidisciplinary medical board review. A team of oncologists, immunologists, and genomic specialists must review the patient's complete history. They need recent PET and CT scans to understand the tumor burden and location. They need biopsy reports and metabolic blood panels.
Why does all of that matter for an immune treatment, though? Isn't the immune system systemic? Like, it's everywhere in the body.
It is systemic, but the application must be precise. They have to determine the specific genetic and metabolic profile of the tumor.
Oh, I see.
For example, some tumors do not express that PD-L1 protein we just talked about, which means a checkpoint inhibitor would be completely useless.
Wow, okay.
Sometimes the tumor burden is so high that an intravenous application of cells won't penetrate the tumor microenvironment, requiring an intratumoral injection instead. The treatment must mathematically match the specific biological lock of the disease. If a clinic offers to sell you a specific cell therapy without demanding and reviewing your scans first, that is an enormous red flag. You should walk away.
That is such a good warning. Which brings us to the actual environment of the body. I was trying to wrap my head around this term we kept seeing, integrative oncology.
It's a huge piece of the puzzle.
Right. Because if the immune system is the engine we are trying to start, these supportive therapies feel like we are changing the oil and upgrading the fuel. Because if you're asking the body to fight a massive internal war, the terrain has to be supportive, right?
The concept of the biological terrain is the absolute cornerstone of integrative oncology. You aren't just attacking the tumor. You are fundamentally altering the environment the tumor lives in.
How so?
Well, cancer thrives in very specific conditions, typically highly acidic, low-oxygen environments with plenty of sugar for fuel. Integrative oncology utilizes targeted therapies to flip those conditions, making the body inhospitable to cancer, but highly supportive of those newly cultured immune cells.
Let's break down how they actually do that, starting with hyperthermia.
Yeah, heat therapy.
Raising the body's temperature sounds incredibly basic compared to dendritic cell culturing. Why is heat an effective weapon?
It sounds basic, but the mechanism is fascinating. Healthy tissue has well-formed blood vessels. When healthy tissue gets hot, those blood vessels dilate to dissipate the heat like a radiator.
Sure, we sweat, we flush.
Right. Cancer tumors, however, build chaotic, malformed vascular structures. They cannot dilate. By safely raising the body's core temperature or using specialized localized equipment to heat a specific tumor site to between 104 and 108 degrees Fahrenheit, the heat gets trapped inside the tumor.
So the tumor essentially cooks itself because it can't vent the heat.
Precisely. This trapped heat breaks down the proteins inside the cancer cells, weakening their defenses and making them far more vulnerable to the immune system. Another major pillar of altering the terrain is high-dose intravenous vitamin C.
Now, most people hear vitamin C and think of an antioxidant to stop a cold. How is this an oncology treatment?
In the massive clinical doses administered intravenously, vitamin C actually changes its behavior. It stops being an antioxidant and becomes a pro-oxidant.
Wait, really?
Yeah. When it interacts with the extracellular fluid around a tumor, it creates hydrogen peroxide. Now, healthy cells have an enzyme called catalase that easily neutralizes hydrogen peroxide into water and oxygen.
Let me guess, cancer cells are missing that enzyme.
They are deeply deficient in it. Without the ability to neutralize the hydrogen peroxide, the cancer cells undergo severe oxidative stress and die, while the surrounding healthy tissue remains completely unharmed.
That is wild.
And they combine this with ozone therapy to flood the body with oxygen and aggressive metabolic nutritional protocols to eliminate refined glucose, which is the primary fermentation fuel for most cancer cells.
You know, I want to touch on one supportive therapy from our research that frankly threw me off at first, biological dentistry. We are talking about advanced oncology, and suddenly we are looking at someone's jawbone. How does dentistry factor into immunotherapy?
It seems disconnected until you view the immune system as a finite resource. A cavitation is a hole in the jawbone left unhealed after tooth extraction, often from wisdom teeth or root canals.
Ouch. Okay.
Yeah, and these dark, low-oxygen spaces can harbor hidden, asymptomatic anaerobic bacterial infections. Your immune system is constantly aware of this. It is dedicating a percentage of its daily resources to wall off and fight that low-grade infection in your jaw.
I see. If you are going to spend weeks culturing white blood cells and giving someone expensive immunotherapy, you want 100% of their immune resources focused on the tumor, not distracted by a 10-year-old dental infection.
Exactly. Biological dentistry evaluates and unburdens the immune system by removing those toxic focal points. It completely shifts the paradigm of what it means to prepare the body for healing.
And that paradigm shift extends to the physical environment of these clinics, too. The literature notes that many of these Mexican cancer centers look more like wellness retreats than the sterile, fluorescent-lit hospitals we are accustomed to. That's the kind of question families ask when they're trying to make sense of everything. They want to know what it actually feels like to be there.
It's a huge contrast
Why design a cancer center to look like a retreat?
because the physical environment directly impacts human biology. The autonomic nervous system operates in two primary gears: the sympathetic state, which is our fight or flight response, and the parasympathetic state, which is rest and repair.
Okay, I follow.
Healing, particularly immunological healing, only occurs efficiently in the rest and repair state. Sterile, noisy, anxiety-inducing hospital environments trigger a chronic stress response, flooding the body with cortisol. And cortisol literally suppresses immune function.
Oh, wow. So the hospital itself can work against the treatment.
It can. These clinics are architecturally and philosophically designed to induce the parasympathetic state. They use natural light, comfortable spaces, and psychological support to optimize the body's physical ability to accept the treatments.
Let's pause, because while this sounds ideal, we have to look at the practical risks. Robert and his daughter are planning to cross an international border for advanced cell culturing. The margin for error when handling someone's white blood cells is zero.
Absolutely zero.
So how do they verify that a clinic is legitimate and not just a beautifully decorated building with subpar medical practices?
The evaluation process must be ruthless. First, families must look for regulatory compliance. The Mexican equivalent to the FDA is COFEPRIS, the Federal Committee for Protection Against Sanitary Risks.
Okay, COFEPRIS.
Right. Any legitimate center must hold valid, up-to-date COFEPRIS licenses for every specific biological therapy they administer.
And what about the physical laboratories? If they are multiplying my NK cells, I want to know the environment is flawless.
You must ask specifically about their cell culturing facilities. The highest standard is the use of ISO-certified, hospital-grade clean rooms. These are heavily regulated, ultra-sterile environments with specialized airflow to prevent any microscopic contamination.
Right, like you're hiring a specialized team for a massive project. You don't just look at the lobby, you look at their tools.
Exactly. Furthermore, look at the clinic's broader accreditations. Are they recognized by the General Health Council, the CSG in Mexico? Do their standards align with the Joint Commission International, or JCI? Do they have a fully equipped intensive care unit? Or immediate transfer agreements with a major hospital in case of an adverse reaction?
Those are critical points.
They are the non-negotiable questions that separate legitimate medical institutions from the rest.
Okay, so let's walk through the logistics. Robert's daughter verifies the COFEPRIS licenses and the ISO clean rooms. The medical board reviews Robert's PET scans and approves a specific dendritic and metabolic protocol. What does the actual physical journey look like from the moment they land?
Typically, patients are looking at a 3 to 4 week intensive inpatient or outpatient program. Logistically, the legitimate centers offer comprehensive, all-inclusive packages.
Meaning everything is handled.
Yes, the goal is to remove the massive stress of travel coordination. Patients are usually met directly at the airport, often in San Diego, for a border crossing to Tijuana or in Cancun, and transported to the facility via expedited medical lanes.
Let's address the financial reality of those packages. Financial toxicity is a crushing burden in cancer care. Without turning this into an accounting ledger, how does the cost structure of an integrative multi-week package in Mexico compare to what someone might piece together in the US or Europe?
It is a driving factor for why these hubs exist. Because of significantly lower operational costs, direct access to pharmaceutical markets without massive intermediary markups, and a different medico-legal insurance environment, these comprehensive packages in Mexico typically cost 40 to 60% less than comparable treatments in the US or Europe.
That is a significant difference.
It is. However, the golden rule is transparency. Families must demand an itemized list of what the package covers: the biological therapies, the daily 5E nutrition, lodging, meals, companion accommodation, to ensure there are zero surprise fees halfway through the protocol.
Transparency is everything when you are vulnerable. Now, 3 to 4 weeks is a significant commitment, but cancer isn't solved in a month. I imagine the care doesn't just evaporate the second Robert is discharged and gets back on a plane.
The post-discharge protocol is arguably as critical as the intensive clinic stay. Legitimate facilities implement a comprehensive home program. Patients are not sent home empty-handed with a good luck handshake.
I would hope not.
They typically return with a 3 to 6 month supply of targeted oral medications, specific immune-modulating supplements, and sometimes continuation vaccines that can be administered locally.
So they are packing up the altered biological terrain and taking it home with them?
Exactly. They are given highly personalized dietary plans to maintain that low-glucose, high-oxygen environment. Most importantly, the clinical connection remains unbroken. Patients engage in regular telehealth video consultations with our dedicated oncology team in Mexico.
That's reassuring.
And as the patient gets new blood work and PT scans done in their home city, those results are analyzed by the Mexican team, and the protocol is adjusted in real time. It is a continuous, monitored loop of care.
This is a tremendously complex journey. You are dealing with cutting-edge cellular science, international travel logistics, financial planning, and the emotional weight of a diagnosis all at once. Going from a panicked midnight search to a structured, evaluated plan changes everything. This is where having organized information can help.
No patient or family should have to navigate the logistics of international medical care in the dark. This is the specific role that PlacidWay fulfills. They act as a logistical bridge.
Right.
They help patients compare these different cancer treatment centers, ensuring families know how to verify those COFEPRIS licenses and lab standards. They help patients review the specific treatment packages and request a free quote so that the financial reality is entirely clear before a single decision is made.
It provides a compass for the map.
Yeah.
Before we close out this deep dive, you mentioned earlier that we would circle back to the concept of the immune system's memory. Why is that the crucial takeaway here?
Well, we often view cancer treatment through the lens of a single, immediate war destroying the tumor that is currently present. But the immune system is fundamentally unique. It possesses a deep biological memory.
Like it learns.
Yes, it learns. When you utilize advanced therapies like dendritic vaccines to properly support, train, and awaken the immune system, you are doing more than fighting the current battle. You are giving the body the molecular blueprint of the threat. You are teaching your own defenses how to recognize and eliminate that specific cancer if it ever tries to return.
Wow.
It shifts the entire paradigm of oncology from simply attacking the disease to learning how to protect the body for the rest of your life.
That is a profoundly hopeful way to view the science. It shifts the focus from mere survival to long-term resilience. We started this conversation talking about that quiet, dark room at 2 in the morning, trying to read a medical map in a foreign language. Hopefully, this deep dive has provided some translation, some biological context, and a clearer path forward. If this topic connects with what your family is exploring, you can use PlacidWay to compare cancer treatment centers in Mexico, ask questions, and request a free quote when you're ready.